The Asian population is diverse, and pharmacists in many countries often encounter various socio-cultural perspectives, including religious and spiritual beliefs that affect medicine use and adherence. To optimize the quality of care and increase patient confidence in pharmaceutical products and services, pharmacists must be equipped with not only pharmaceutical or scientific competence but also ethical and cultural sensitivity. Islam is the one of the most prominent religions in Asia. With around 1.2 billion followers, Southeast Asia and South Asia are home to nations with over 100 million Muslims, including Bangladesh, India, Pakistan, and Indonesia. With Indonesia having the large Muslim population of over 225 million. In Central Asia, Uzbekistan and Afghanistan are the two countries with the largest Muslim population, while non-Arab nations of Turkey and Iran have the highest number of Muslims in Western Asia. Other major Muslim countries include Lebanon, Oman, Yemen, Bahrain, Iraq, and Qatar. Pharmacies not only in Muslim countries but also in countries with a multicultural population often encounter patients with Islamic concerns such as pharmaceutical excipients of animal origin and medication use while observing religious fasts. The influence of Islamic beliefs and practice on medication management is important, especially during the month of Ramadan. In recognition of the need to pharmacists to build public confidence in using pharmaceutical services and products, FAPA works in partnership with its member associations to promote evidence-based pharmacy practice by culturally competent professionals. The Indonesian Pharmacists Association, Ikatan Apoteker Indonesia, is collaborating with FAPA to host today's webinar. Roles of pharmacists in optimizing care for Muslim patients during Ramadan, with expert speakers. Dr. Apoteker Lusy Noviani Magister Management, Vice Secretary General Ikatan Apoteker Indonesia, a hospital pharmacist, with the topic Consideration in Medication Management During Observation of Fasting in Ramadan, with diabetes mellitus patient as case study. Mr. Amrahi Buang, President of Malaysian Pharmacists Society, with the topic Promoting Patient Confidence in Pharmaceutical Products Through Halal Certification. The webinar will be continued with panel discussion about best practice in selected Asian countries from FAPA member association. Role of the webinar. Please turn off microphone and camera during the event. The host will also turn off microphone and camera during the event. Camera will be reactivated after the event. Questions can be posted in Q&A column, and the participants will be asked to participate in the activities according to the specified time. Thank you and please enjoy the webinar.
Hello, Tess?
Okay.
I'm sorry. I don't know. I think we already test, but I don't know what happened. Okay, I will start again. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon to all participants, colleges pharmacists in all Asia Pacific region, dan selamat siang untuk para apoteker seluruh Indonesia. My name is Anggun, and I will be the host and also the moderator for today's event. And I hope you can join until the very end. Well, other than me, there are also Miss Christine Ching Benosa, Secretary General of FAPA, as a moderator for the webinar today. Okay, before we start, we have a few distinguished guests I'd like to mention. Honorable President of FAPA, Professor Dr. Yolanda Robles, Honorable Immediate Past President of FAPA, Mr. Joseph Buang, Honorable President of IAI, Bapak Nurul Falah, Honorable Secretary General of IAI, Bapak Novendri, Honorable President of Federation Taiwan Pharmacists Association, or FTPA, Mr. Jinsun Huang, Honorable President and members countries of FAPA, distinguished speakers and the panelists, Mr. Amrahi bin Buang, Dr. Apoteker Lusy Noviana, Dr. Nadia Rashid Al-Mazroy, Dr. Rabiel Kanwal, and Miss Christine Esther Flor El-Katora. Thank you so much for attending today's event. Well, we are very happy that more than 2,000 pharmacists are joining our event today, not only from Indonesia, but also from other countries in Asia Pacific, as well Western Asia. I see there's a total 11 countries that joining our webinar today. We have a representative from Bangladesh, India, Macau, Malaysia, Nepal, Pakistan, Philippines, Sri Lanka, Taiwan, and the United Arab Emirates. Good morning there. Well, I also want to take a moment to recognize and thanks to IAI in a collaboration with FAPA and FTPA, supporting by SIAP and PharmaQ who make today's event possible. Thank you. Without further ado, I will invite Bapak Nurul Falah, President of IAI, to give welcoming speech, and then we'll continue with Dr. Yolanda Robles, President of FAPA. Please.
Thank you, Anggun. Bismillah. Assalamualaikum warahmatullahi wabarakatuh. Honorable President of FAPA, Professor Dr. Yolanda Robles, Honorable Immediate Past President of FAPA, Mr. Joseph Buang, Honorable President Federation Taiwan Pharmacists Association, FTPA, Mr. Jinsun Huang, Honorable All President and members countries of FAPA, distinguished speaker and panelists, Mr. Amrahi from Malaysia, Dr. Lusy from Indonesia, Dr. Nadia from Uni Emirates Arab, Dr. Rabiel Kanwal from Pakistan, and Ms. Christine Esther from Philippines. Colleagues from IAI, FAPA, and FTPA. How are you, colleagues? I hope everything is well. First of all, let us praise to Allah Subhanahu wa Ta'ala who has given the gift of health and opportunity to be able to gather online in Indonesian Pharmacists Association collaborative activities with FAPA. A webinar theme, Roles of Pharmacists in Optimizing Care for Muslim Patients During Ramadan, which started by the signing of the MOU between IAI and FTPA according to the following scope: exchange and joint publication in research material, activities from medical journal, including medicine, name list of experts, as well as photos and videos of related activities, exchange opinion on pharmaceutical research and technology, pharmacist practice improvement through the exchange information and pharmacist competency standard, pharmacist code of ethics, pharmacist professional education standard, pharmacist practice standard, and also pharmacy student placement or internship and residency. Then continuous professional education, collegium activities, specialist education, and advanced. And also exchange opinion and information of pharmaceutical society activities program, exchange opinion on pharmaceutical regulatory affairs, provide pharmaceutical society activities information and updates, organize delegation for mutual visit and provide necessary assistance and other issues identified and agreed by both parties. As the host of this event, I would like to thank FAPA for trusting IAI to organize this activity. Although the time for preparation is relatively short, but the participant now is 880, consisting of participants from local and Indonesia and also international participants. But I think the partner is coming, then the number I think will increase. As Mr. Joseph Buang has often said that the Asia Pacific pharmacist is one for all to the pharmacist profession. So let us contribute to the professionalism and welfare of pharmacists through programs and activities organized by FAPA. Let us establish cooperation among country members to advance professional pharmacists in Asia Pacific under the coordination of FAPA. I also take this opportunity to express my gratitude for the support of Mr. Joseph Buang, who has given IAI the friendly support and increased the competence of Indonesian pharmacists through training and sending experts in good pharmacy practice program field to Indonesia, whether in annual scientific meeting or other IAI activities, including attending and providing assistance during disasters in Banten and in Palu. Mr. Joseph Buang is truly like my brother, including to initiate this event. I hope that the pandemic would be end forever, and I invite Taiwan delegation to visit us in Indonesia. Hopefully, this kind of relationship could be continued among country members, in addition to strengthening the relationship between country members as well as to improve the professionalism of pharmacists in their own countries. Finally, welcome to the webinar. Hopefully, it will be useful for all of us. Thank you, good afternoon, and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Afternoon and greetings from the Federation of Asian Pharmaceutical Association. It is a pleasure to be with you today. Today's webinar would not have been possible without the able initiative of IAI, or the Ikatan Apotheker Indonesia, in partnership with FAPA. And I commend the leadership of Dr. Nurul Falah Edi Para regarding the organization, the immediate organization of this webinar. I am also happy that the historical signing of MOU between IAI and the Federation of Taiwan Pharmacist Associations, led by Dr. Jinchu Huang, will also happen today. Congratulations to the two organizations. I also acknowledge at the moment the presence of the President of the Asian Association of Schools of Pharmacy, Dr. Kenichi Inoue of Japan. Thank you very much for gracing this occasion. And this webinar would not have happened if we don't have participants who are willing to learn about the theme from the different countries in Asia. So our member organizations are coming from Indonesia, Malaysia, Philippines, India, Bangladesh, Nepal, Pakistan, United Arab Emirates, Korea, Taiwan, and Sri Lanka. The theme of this webinar, the role of pharmacists in optimizing care for Muslim patients during Ramadan, is very timely, given that our Muslim brothers and sisters are celebrating the Ramadan at this time. FAPA's vision is to ensure access to safe, cost-effective, and quality pharmacy services and products to improve health outcomes of Asian people. As pharmacists, we need to ensure that our patients' health are not compromised and that they are provided quality products in respect of their cultural values. This webinar is an example of the possible partnerships that could happen between and among pharmacy organizations in Asia to address local and regional practice needs and issues. At this point, I hope that we will learn a lot from our distinguished speakers who will talk about the care and services that our Muslim brothers require during Ramadan. I am confident that all of you will benefit and learn from our distinguished resource speakers and panelists of today's event. Lastly, let me invite all of you to join the 28th FAPA Congress, which will be held in Kuala Lumpur in November 12, 10 to 12, 2022, with the theme, Pharmacies Building Better Health Systems. So I hope that we will all cooperate, we will all collaborate to have a strengthened pharmacy system in Asia. So at this point, let me wish you a productive afternoon. Take care and keep safe.
Okay, thank you Bapak Nurul Fala, and thank you Dr. Yolanda. Thank you so much for your welcoming and warm speech. Well, and don't forget to joining the FAPA 28th FAPA Congress in Kuala Lumpur this November. Okay. Well, I can see the participant number is. So before we start with the very insightful webinar about the roles of pharmacies, we also have a momentous moment. Today, will mark a significant milestone for two pharmacists associations, the Indonesian Pharmacists Association, IAI, and the Federation of the Taiwan Pharmacists Association, FTPA. It's momentous because they will forge a strategic partnership. The MOU is the manifesto of support to improve mutual understanding and the friendship between FTPA and IAA, as well as providing added value to improvement of a pharmacist's professionalism. Well, recognizing the need of this MOU between two associations, I will invite to both parties to start the MOU signing. Please.
Bismillah. Assalamualaikum warahmatullahi wabarakatuh. Presiden FAPA yang saya hormati, Profesor Dr. Yolanda Robel, Taiwan Pharmacists Association, Mr. Buang, dan all President Members Country of FAPA, para tamu undangan, dan tentu saja sejawatku apoteker Indonesia. Apa kabar? Mudah-mudahan semuanya sehat walafiat dan berkah. Bapak dan Ibu sekalian, hari ini kita lebih bahagia dari biasanya karena hari ini kita akan melakukan penandatanganan MOU antara Ikatan Apoteker Indonesia dengan Federasi Taiwan Pharmacists Association, di mana antara kita dengan Taiwan persahabatannya sudah dimulai oleh beberapa waktu yang lalu, yaitu ketika Mr. Joseph Wang sebagai ketua atau chair dari FAPA Foundation yang telah memfasilitasi apoteker-apoteker Indonesia untuk dilakukan training good pharmacy practice di Taiwan, di Taipei, ya. Dan alhamdulillah beberapa apoteker kita bisa kita berangkatkan ke sana, dan juga pada saat yang sama delegasi dari Taiwan, expert GPP juga datang ke Indonesia pada acara PIT, pada acara Rakernas. Bahkan kita pernah memiliki kerjasama dengan Kota Bekasi dalam rangka training GPP untuk seluruh rumah sakit di Kota Bekasi pada saat yang lalu. Nah, dari persahabatan itu muncullah ide kalau kita secara formal sebaiknya melakukan perjanjian kerjasama yang untuk awalnya kita buat MOU-nya terlebih dahulu dalam rangka mutual benefit antara apoteker Indonesia dengan apoteker yang ada di Taiwan. Dalam rangka apa? Kalau kita lihat lingkup dari MOU ini, nomor satu adalah pertukaran terkait dengan hasil-hasil riset yang mungkin bisa dipertukarkan tentu saja, ya. Kemudian jurnal, publikasi, kemudian majalah, ya. Kemudian berikutnya adalah pertukaran yang terkait dengan praktek kefarmasian di setiap area praktek kefarmasian, apakah di industri, di distribusi maupun di pelayanan kefarmasian, dengan lingkup sediaan farmasi, obat, bahan obat, obat tradisional, kosmetik, maupun juga suplemen makanan maupun suplemen kesehatan. Bahkan alat kesehatan dan juga bahan medis habis pakai. Kemudian yang ketiga, yang penting adalah kita saling berbagi, bertukar informasi tentang standar kompetensi apoteker. Bagaimana di Taiwan, bagaimana di Indonesia, apa yang bisa kita saling ambil positifnya dari kedua negara ini. Kemudian bagaimana pula kode etik dan pelaksanaan dari kode etiknya apoteker di Taiwan. Bahkan juga sampai ke ada standar kompetensi, ada standar pendidikan, yang ini ranahnya konsil kefarmasian. Pada saatnya kita juga pengen belajar bagaimana teorinya di-deliver kurikulumnya, dan bagaimana terutama praktek kerja profesi apotekernya dilakukan di Taiwan, ya, sehingga kita juga pengen sharing yang terkait hal itu. Nah, juga standar pendidikan tidak hanya untuk apoteker, tapi mungkin apoteker spesialis, bahkan juga program advance, dan jika memungkinkan juga pertukaran mahasiswa. Kalau pemerintah punya program Merdeka Belajar Kampus Merdeka, kenapa tidak? Kita Ikatan Apoteker Indonesia yang juga ikut bekerja sama dengan perguruan tinggi dalam rangka mendidik apoteker ini, bisa juga ranah pendidikannya kita bekerja sama dengan Taiwan, sehingga dengan demikian kalau adik-adik yang mampu melakukan perjalanan perjalanan atau stay bahkan di Taiwan dalam rangka belajar, dalam rangka praktek, ini juga masuk di dalam ruang lingkup kerjasama ini. Harapannya apoteker Indonesia semakin praktek profesional dengan bekerja sama ini, dan ada hal-hal baik yang bisa kita terapkan di Indonesia. Yang saya tahu kalau good pharmacy practice di sana rata-rata diterapkan dengan baik di area pelayanan baik rumah sakit maupun juga di apotek, sehingga setidak-tidaknya itu juga kita bisa belajar, dan mudah-mudahan ini manfaat untuk apoteker Indonesia. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Mr. Huang, are you ready there? Because we will put spotlight on you.
Yes, we are ready.
Yes.
敬爱的印尼药师会会长露露会长，亚洲药协会尤纳达会长，王文普会长，马来西亚药协会Amrahi会长，所有印尼药师会的会员朋友，以及中华民国药师公会全国联合会的干部，大家午安，大家好 ，Selamat siang。
Honorable President of Ikatan Apoteker Indonesia, Dr. Andes Nurul Farah Edi Parian, President of Federation of Asian Pharmaceutical Associations, Dr. Yolanda Robles, and former President, Mr. Joseph Wang, President of Malaysian Pharmaceutical Society, Mr. Amrahi Buang, dear members from Ikatan Apoteker Indonesia, dear colleagues from Federation of Taiwan Pharmacists Associations, distinguished guests, ladies and gentlemen, good afternoon. Selamat siang.
我是中华民国药师公会全国联合会理事长黄金顺，今天非常高兴代表药师公会全国联合会与印尼药师会签了解备忘录，两会将缔结成为姐妹会。
I am the president of Federation of Taiwan Pharmacists Association, Jing Huang. It is a great honor for me to be here on behalf of our association to sign the memorandum of understanding between Federation of Taiwan Pharmacists Associations and Ikatan Apoteker Indonesia. Starting from this day forward, we are becoming sister associations.
台湾跟印尼一样，是太平洋上岛屿的国家。印尼甚至比台湾拥有更多的岛屿，也拥有更多元的文化。因此，在许多议题上，双方都有可以交流的地方，例如医院药学、社区药学、慢性病管理、健康保险、传统医学等等。
Similar to that of Indonesia, Taiwan is an island nation on the Pacific Rim, with diverse cultures enriched on the islands of Taiwan, and even more so in Indonesia. There are many fields of knowledge and expertise that both sides can exchange and benefit from, such as hospital pharmacy, community pharmacy, chronic disease management, health insurance, and traditional medicines.
亚洲药协会王文普前会长居中连结，印尼药师会的努努会长首肯促成这桩相互合作的好事。诚如过去亚洲药协会的口号 "We are one"， 台湾与印尼这两个太平洋上不同文化的国家可以更紧密的结合，我们可以凝聚更大的力量。
I would like to thank Mr. Joseph Wang from FAPA for fostering the communication and promoting the cooperation of this memorandum. And I would also like to thank Dr. Randas Nurul for putting all efforts and agreeing to sign this memorandum. As the slogan of FAPA, "We are one," implies, Taiwan and Indonesia can work closely together and create synergies for both countries.
台湾如同大家耳熟能详，是一个科技之岛，也是亚洲最民主的自由国家之一。事实上，台湾不只有科技与民主自由，在达前人健康照护也有丰富的经验。其中，台湾药师透过医药分业、公共卫生参与，角色功不可没。
Taiwan is renowned for its information and communication technology, as well as being one of the Asian countries with full democracy. While having rich experience in technology and democracy, Taiwan has also gained experience in implementing national health insurance to reach universal health coverage, in which pharmacists have played important roles through the separation of prescribing and dispensing and public health participation.
疫情以来，台湾药师透过口罩实名制、疫苗预约、送药到府，更展现强而有力的韧性。
Since the COVID-19 epidemic, Taiwan pharmacists have demonstrated great resilience through the name-based mass rationing plan, vaccination appointments, and medication home delivery service.
过去，亚洲药学基金会 FAPA 的帮助之下，台湾与许多印尼药师透过医院优良药师职业训练 （GPP） 进行了相当多的交流。不止许多印尼的药师到台湾来参访，台湾的药师也到印尼进行实质的交流，双方都收获很多。
In the past, with the help of the FAPA Foundation, there has been close cooperation between pharmacists from Indonesia and Taiwan through GPP training. And through exchanging, pharmacists from both countries were able to visit the other country and gain experience and knowledge for future improvements.
台湾、印尼双方可以在今天签订了解备忘录，相信对于未来的交流更是向前迈进一大步。我们再次感谢印尼药师会诺诺会长，在他带领下与我方结成伙伴关系。最后，祝福印尼药师会会务昌隆。更进一步，我也祝福大家身体健康。Terima kasih.
In closing, as the memorandum is to be signed today, we will be able to achieve more and continue to develop even stronger relationships and friendships between the people of Indonesia and Taiwan. Thank you so much once again, Dr. Randas Nurul, for your leadership and partnership. Finally, let me wish Ikatan Apotekla Indonesia a prosperous future, and to all, good health. Terima kasih.
We will start the ceremony, signing the document. Now what document? Probably give a pause for this. I don't know how we do it. Okay. Camera, because we will going to take a picture. All the panelists and everyone, please open the camera. So we will take a picture. Everyone. I would like to call Dr. Lusy and Dr. Rabail and Ibu Sus. Okay. I think everyone is ready here. Pak Fauzan, please take a snapshot for this.
Okay. Everyone, please smile to the camera. Okay. 1, 2, and 3. Once again. 1, 2, and 3. Thank you very much.
Okay, thank you so much, everyone. Now we have the video closing profile of IAI and FTPA. So don't forget to watch, okay? Okay, congratulations for IAI and FTPA. We hope with this MOU, this can improve the pharmacist professionalism between the countries. So now we are going to continue to the webinar that we've been waiting for. So it's time to call my colleague Christine. Hi, Christine, are you there? She will moderate our webinar today with a very great speaker and panelist.
Hi, Anggun.
Hi. So, Christine will live from Philippines. Hi, how's there?
We're good here. The weather is good.
Okay.
Hello, Anggun. So thank you very much and good morning and good afternoon to our participants from all over Asia. To introduce myself, I am the Secretary General of FAPA. My name is Christine Ching Benosa. And first, I would like to congratulate IAI and FTPA for finally signing their MOU, and would also like to thank Dr. Yolanda Robles, Dr. Nurul Fala, and Dr. Jinshun Buang for your inspiring messages in the first part of the program. Now we have finally come to the official webinar, or the second part of this program, which is titled The Roles of Pharmacists in Optimizing Care for Muslim Patients During Ramadan. This event highlights the level of cultural competence of pharmacists in Asian countries, and the diversity in Asia calls for all healthcare providers, healthcare systems, and policymakers to actually create and deliver culturally competent services. For this event, let me define cultural competence, which is the ability of providers and organizations to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients. A culturally competent healthcare system is believed to help improve health outcomes and quality of care, and can contribute to the elimination of racial and ethnic health disparities. So we hope that this webinar will promote cultural competence among Asian pharmacists by first, sharing best practices of pharmacists in ensuring the attainment of health and treatment outcomes while respecting the rights, beliefs, and religious practices of patients, particularly in Islam. Second, discuss the latest developments and clarify misconceptions regarding halal pharmaceuticals. And third, present ways how pharmacists can empower patients against misinformation related to their cultural, religious, and health practices. So I think with the recent experience of all countries with the COVID-19 pandemic, we are in a constant battle with misinformation, and this is further complicated by our existing cultural and also religious beliefs and health practices. So without further ado, let me introduce to you our first speaker to talk about the considerations in medication management during observation of fasting in Ramadan. So our first speaker comes from Indonesia. She is Dr. Apotheker Lusy Noviani, Master of Management, and she is also serving as the Vice Secretary General of Ikatan Apotheker Indonesia. So she graduated as a pharmacist from Gadjah Mada University in Yogyakarta, and the Master of Management also in Esa Unggul University in Jakarta, and completed her Doctor of Pharmacy in Padjadjaran University in Bandung. She has experience as a pharmacy manager at Atmajaya Hospital in Jakarta, a lecturer at the university in the same Atmajaya Hospital in Jakarta, and also a pharmacy manager at Omni Hospital in Tangerang. So in terms of her organizational affiliations, she served as a Vice Secretary General from 2018 up to the present, and she has worked at IAI in the FIP Workforce Transformation Program Project Team from 2018. And she's also the Vice Secretary of the SKAI Team, National Competency Standard Framework of Indonesian Pharmacists from 2018. So please help me welcome Dr. Lusy Noviani. Hello, Miss Lusy. It's nice to see you again.
Hello, how are you?
So I'll give the floor to you now. Thank you.
Okay, Christine. Thank you very much for the time you gave to me. It's my voice clear. from there, Christine?
Yes, it's clear.
Okay, thank you, thank you. Please wait a moment. I will share my presentation. It's already can see it, Christine?
Yes, it's now on the screen. Thank you.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Hello everyone and welcome to today's session. I'm super excited to have you here and thank you for taking the time to join us today as we talk about consideration in medication management during observation of fasting in Ramadan, and we focus today in patient with diabetes mellitus. Saya berharap teman-teman sejawat hari ini di Indonesia dalam keadaan sehat juga bahagia ya. Oke. And this is our learning objective in our discussion is describe the religious practice that have made an impact on health or medication adherence during Ramadan, and what's important consideration should pharmacists pay attention in relation to fasting, especially in people with diabetes, and how pharmacists can empower Muslim patients against misinformation related to their culture and health practices. Okay, and this is the outline that we will discuss together today. And okay, let's make a start. Before starting this discussion, I want to interact with all of you, my colleagues and teman sejawat di seluruh Indonesia. In your opinion, what is the patient biggest problem during Ramadan, especially regarding medication management? Can you write your opinion in chat? Mungkin teman-teman sejawat punya pengalaman selama teman-teman sejawat praktek selama Ramadan, kira-kira problem apa sih yang teman-teman sejawat rasakan pada saat pelayanan, pada saat memberikan edukasi kepada pasien-pasien yang menjalani puasa. Mungkin teman-teman bisa menulis di dalam chat. Can you write on your opinion chat, maybe in medication schedule or adherence or dosage form or else? I don't know, but I want to know what in your practice. Okay, I already see the time, waktu minum obat, time schedule, time to take medicine for Yusansa, my colleagues, and Philippine, Maima is medication schedule. Yes, of course. And Philippine Sherilyn is medication schedule too. Yes, medication schedule too. Yes, this is the common problem we must face as a pharmacist. So many problems related to patient during the month of Ramadan, and we must to face one by one to help patient to support the patient. Okay, we already know there is changes in sleeping and feeding pattern during Ramadan. For most, Ramadan fasting disrupt typically in eating and sleeping pattern. We know that during non-Ramadan, there is a breakfast, lunch, and dinner at specific time. Yeah, but during Ramadan, breakfast in suhoor and there is no lunch. And the iftar meal is taken just after sunset. Also, during non-Ramadan days, the sleeping pattern is continuous from the night, through to the early morning hours while in Ramadan. And in Ramadan, we say that sleeping pattern is more fragmented between the early morning hours and the afternoon and midnight. We already know that sleep and meal has been associated with glucose level, weight, and hormone. And then, as we know, fasting also has an impact on healthy people who fast. Studies were conducted by Cool show that fasting has an impact on blood lipid, body weights, and hormones. In blood lipid, we can see that fasting can significantly decrease in LDL or increase the HDL for female, and significant decrease in triglyceride for male. And fasting also affect on body weights and also affect on hormone like leptin, adiponectin, and we already know that adiponectin is not only play a role in glucose metabolism and insulin sensitivity, but also play a role in regulating plasma fat level. And leptin, we also know the function is to reduce the amount of food intake in increase energy and maintain the body weight. So we agree about that fasting is have impact health for healthy individual. Okay, the question is, how about people who are sick? Can they take medication while fasting? Yes, the answer is yes. Typically, it is okay to take medication while they fast, but it depends on the specific medication on the patient condition. So we must assessment the patient first before we suggest or we advise the patient can fasting or cannot fasting. On the other hand, we already know that fasting during Ramadan is important to Muslim, and it is constitutes one of the 5 pillars of Islam. But under certain condition, Allah allow people not to fast. In Surat Al-Baqarah mentioned that, so whoever is present this month, let them fast. But whoever is ill or on journey, then let them fast an equal number of days after Ramadan. So therefore, there are people who are exempt from fasting, including children, elderly, chronic or acute ill, traveler, pregnant, and we already know the breastfeeding breastfeeding woman. And then how to take medicine while fasting? Fasting on medication is in fact allowed during Ramadan as long as this is prescribed or advised by a doctor or pharmacist. Anyone who takes medication should be assessed before partaking in the Ramadan fast, especially if the number of doses of this medicine is 2 or more times, or if the medicine need to be taken before food or at a certain time of the day. And this is what patients are confused about the effect of fasting on the effectiveness of this drug. If doctor and pharmacist advises patient that it is in your best interest not to observe the Ramadan fast, then it's important to follow this advice. In this instance, patient can still pay their dues to Allah via fidyah. So how can people who take medicine keep fasting? What considerations should a pharmacist take about this case? The number one is we must to make sure safety first. Safety first to make sure that the patient can go safely from dawn, from insur, from sahur, dari sahur ya, until sunset, until iftar ya, without medicine. So we must to make sure the patient can go safely from dawn to sunset without meds. Number one, safety first. Number two, adjust time of meds. Because oral medication are prohibited during the fasting hours, medication schedule may need to be adjusted. For example, if doctor prescribe azithromycin once daily dose, may be preferable pharmacists give advice to treat an infection over amoxicillin. Ya, jadi bisa diganti jenis obatnya berdasarkan bentuk sediaan sehingga pasien bisa menggunakan obat dan berpuasa dengan lebih baik. So when adjust time of meds, adjust oral meds so that a patient only need to take them 1 or 2 times per day at dawn or at sunset, dari sahur ataupun buka puasa. Ya, number 3 is adjust type of medicine. Adjust type the medicine if the dosing time cannot be adjusted, consider a different treatment option. Jadi bisa saja kita memberikan usulan kepada dokter merekomendasikan bentuk sediaan obat tersebut, maybe dalam bentuk sustain release, kemudian dalam bentuk lepas lambat dan lain-lain ya. And the number 4 is consider the illness. Consider the illness is illnesses such diabetes, migraine, and hypertension maybe need special attention. However, with a lack of guidance, medication compliance is severely affected during Ramadan. A survey in the UK found that 23% only patients did not take their medication at all during Ramadan. Just as alarming is that 48% of patients double their dose to compensate for medication normally taken twice a day. So it is clear that Muslims with chronic illness require counseling and advice on how to manage their medication during the month of fasting. Okay, and some diseases that require attention, we already know we must attention for some diseases like diabetes, hypertension, hyperlipidemia, infection, cold and flu, and heart disease. Diabetes is the highest disease that require attention in use and dose adjustment. And the question is, how can pharmacists can support and advise patients during Ramadan? Of course, first we get information about the patient medical history and medication use and discuss the previous fasting experience and discuss the lifestyle changes to routine during Ramadan with the patient. And once we have the information, we can assess. Yeah, we can assess and re-stratify patient. And after that, we can create the categories for the patient, whether they are in the moderate low risk for fasting or in high risk for fasting, on very high risk for fasting. Yeah, with patient with the category high risk, pharmacists must advise patient to trial fast prior to Ramadan. Advise to patient to break fast when the red flag like a hypoglycemia, hyperglycemia, ketoacidosis, and maybe some else symptom bad for happen with patient, and we must to advise the patient to break the fast soon because this is the high risk for the patient. And pharmacists can help for adjusting medication too. Pharmacists can help patients adjust their medication during Ramadan to ensure safe and effective therapy while fasting. Medication adjustment can include maybe adjust the timing of medication throughout the day, changing short-acting formula to longer ones or twice daily doses, or maybe considering alternate routes of administration. So if we get a sample, yeah, like a patient get a more than twice daily dose from doctor, maybe as a pharmacist, we can try to replacing drug that require multiple daily dose with another drug from the same therapeutic class that has a more suitable schedule, like a once or twice daily dose. And where possible, change the drug to the extended or slow release. And we already know too that medicine can break the fast. Yeah, medicine that can be taken while fasting without affecting to fasting. You must to educate the patient to like eye, ear, nasal drop, nasal spray. Patient using topical Medicaid cream, ointment, and pads, and vaginal, rectal, suppository, and else. This medicine can be taken while fasting without affecting in fasting. So the patient not worry about using this medicine. And the question is, how about patient with diabetes? We already know that diabetes is one of the most challenging conditions to manage during Ramadan, and patients with diabetes require close monitoring. Most Muslim patients with diabetes already will, of course, will fast. And we know that fasting is possible in patients with diabetes, even if they are insulin dependent. However, we must know that fasting is also at risk diabetic patient. Major risks associated with fasting in patients with diabetic are hypoglycemia, hyperglycemia, diabetic ketoacidosis, and dehydration. And then what should we do to avoid the risk? What the role of pharmacists to help to support the patient to avoid the risk in diabetic ward fasting? Of course, we have to review the medical and then determine the education profile based on the risk category we define. Yeah, and diabetes education like risk of fasting, when to breakfast, blood glucose monitor. Also, we must to educate the patient, so the patient know how to know the symptom, when to breakfast, and how to monitoring the blood glucose. And after that, we must to follow up and check the patient post Ramadan, like A1C, blood pressure, lipid, and also if needed, we just resume the pre-Ramadan treatment regimen. Now, based on the risk categories, we can advise the patient to fast or not to fast. Patient allowed to fast, yeah, if a patient categorized by low risk and moderate risk, so patient allowed to fast. If well-controlled diabetes, if the patient insists to fast in particularly high or very high risk patient, diabetes education should be provided to minimize the risk of complication and for optimal management of diabetes and overall well-being. And this is the recommended timing to check blood glucose level during Ramadan. The patient should be advised to monitor of blood glucose level while fasting. When to check blood glucose during Ramadan fasting? At least 7 times, at the pre-dawn meal, at the morning, at the midday, at the mid-afternoon, and pre-sunset meal, and 2 hours after iftar, and anytime when the symptom of hyper, or feeling unwell happen with the patient. Consult patient that if they experience hypoglycemia, they must always and immediately break their fast, because blood glucose level only drop further without the treatment. Yeah. And we already know that this study have shown that the proportion of patients experience hypoglycemia even while fasting is consistently lower for second generation sulfonylurea. These pictures show that sulfonylurea is a class of anti-hyperglycemic that should be used with caution during Ramadan. Fasting may increase the risk of hypoglycemia by 20%, although glycolic acid has a significantly lower risk of hypoglycemia during Ramadan. So it can be our considered to change or to talking with doctor and collaborate with doctor to change the medicine of class sulfonylurea. Now, depending on the patient diabetic medication regimen, the doses, timing, and or frequency of anti-hyperglycemic may need to be adjusted, primarily to avoid hypoglycemia. The total daily dose of sulfonylurea remain unchanged. Once daily sulfonylurea should be taken with the evening meal instead of the pre-dawn meal, as this is usually the last meal during Ramadan. Twice daily sulfonylurea should be taken with each main meal Example, pre-dawn meal and evening meal. The large dose should be taken with the evening meal. Yeah, if hypoglycemia occur during the day, the pre-dawn meals dose should be reduced or temporarily discontinued during the month of Ramadan. And wait. Why stop? Okay. Now, like a patient on oral medication, we already know diabetes patient on insulin should also be assessed, monitor, and adjust dose if necessary. In this picture, we can see that a patient have glucose less than 70. So if patient using the basal insulin must reduce 4 unit in the iftar and reduce 4 unit after post iftar. Yeah, pre-iftar and post iftar. And the question then, what is the question is what is the role of the pharmacist during Ramadan? We already know that pharmacists can offer professional advice and on the management of medicine and can speak with the patient GPs to make any necessary changes to their medication, to their medicine regimen in preparation for Ramadan. Many drugs prescribed for various conditions are available as an immediate release, medium release, and sustained release. And this means that certain type of medicine can remain and be effective in the body for longer period of time. So pharmacists can help Muslim adjust medication safely during Ramadan to identify anyone who cannot safely do so. Each patient is different and respond to medicine in different way. We have to review the medical and then determine the education provide based on the risk. Okay, and this is the last my slide, the for take home message. And the take home message for my colleagues untuk teman sejawat di seluruh Nusantara is that pharmacists have a big role to play in helping Muslims adjust medication safely during Ramadan and to identify anyone who cannot safely do so. There is plenty of opportunity to support Muslim patients during Ramadan. But we all have a lot to learn about how to do so safely. Okay, it's about my presentation, and thank you, Christine. I back to Christine.
Thank you, Dr. Lusy.
Yes, and this is our reference. If the colleagues want to take the reference, untuk teman-teman sejawat semua, ini referensi yang saya gunakan selama presentasi tadi. Thank you.
Thank you, Dr. Lusy, for describing religious practices during Ramadan, considerations that pharmacists should pay attention to, and how pharmacists can empower Muslim patients against misinformation in relation to the practices. And I also liked how you highlighted how we should prioritize patient safety, especially when advising patients on their treatment. I think it's also good that we saw the roles of pharmacists in identifying and assessing the risks as well as education of patients. Now, I am sure participants have more questions. So later at the end of the program, we will have a Q&A portion. So if you have any questions for Dr. Lusy, please type them in the Q&A box. Thank you, Dr. Lusy.
Thank you. Thanks, Tim. Bye.
Now we will go to our next speaker to talk about how to increase patient confidence in pharmaceutical products through Halal Certification. So our next speaker is Mr. Amrahi Buang, the president of the Malaysian Pharmacists Society, or MPS. He is deeply enthusiastic about halal pharmaceuticals and halal-centric pharmacy practice, and is considered one of the leading subject matter experts on this topic in Malaysia and abroad. Over the years, he has given numerous talks related to this subject throughout Malaysia and abroad. He has been interviewed by different TV and radio stations and also in social media on the subject matter. This is not a new passion for him, as he pioneered in this field in the University Malaya Medical Center, UMMC, Kuala Lumpur, since 1998. And he has served 35 years in this teaching hospital. Currently, he is a member of the Technical Committee and Working Committees of MS 2019 Halal Pharmaceutical Standard, the only global halal standards for pharmaceuticals. And he is also in the Technical and Working Committee for Halal Medical Devices Standard, MS 2636-2019, also the first in the world. He is a certified halal trainer in this field. Mr. Amrahi has done business coaching on halal-centric customer service for Duo Pharma, Halal Pharmapreneur for 33 participating community pharmacists in 2017, 2018, 2019, 2020. He has presented many papers on the subjects related to halal pharmaceuticals both in Malaysia and abroad. Among others are the guidelines for the use of non-halal medicines for Muslim patients, and the Halal Guide for the use of pharmaceutical intoxicants in medicines. He has contributed immensely to 2 national guidelines in Malaysia on Islamic perspectives on medicine. So we have a very good expert speaker today on this topic. Welcome, Mr. Amrahi. I'm giving the floor to you for your presentation. And if there will be any questions from the audience, just please type them in the Q&A box. Thank you.
Thank you, Christine. Is my mic okay?
Yes, it's working well.
Okay, so I will share my slide first, yeah? Is it okay?
Yes, it's on screen now. Thank you.
Okay, all right. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good day and salam Ramadan to all present here. First of all, I would like to say a big thank you to the organizer, Ikatan Apotheca Indonesia, and FAPA for inviting me to talk about this field that I have been involved since 1998. The topic of my talk is promoting patient confidence in the pharmaceutical product through halal certification. Open. I can't move my slide. Can someone help me? Hello.
Yes, Mr. Amrahi, EIE is trying to fix the technical issue.
Yeah.
Thank you.
If I can't control here, you can we can use the backup. Is it okay? Okay. Can I have the next slide, please? All right. From the content, I will try to give some introduction regarding halal. And I also cover the difference between halal pharmaceutical and halal certified pharmaceutical, and also some part of the halal centric pharmacy service. Next slide, please. All right, as I mentioned earlier, this is actually a very long journey, 24 years, in terms of doing this, starting in UMMC way back in 1998, where at that time, I was given the responsibility to look into this matter. And I have a lot of discussion with fellow academy in the Islamic studies, as well as religious scholars, including muftis and Professor Dr. Umar Hassan Kasuli. So by right, this is actually the beginning of the halal-centric pharmacy practice. Next. Well, this is some of the eminent scholars that have been interacted at that time. Most of them are Muslims. And the Professor Dr. Omar Kasuri is actually a master in public health, and she's a leader in bioethics, which we actually learn a lot when actually consult about practice regarding Islamic from a perspective in medicine, as well as from medication. Next. All right, I just want to share with you what is actually halal. Halal is actually in Arabic just mean permissible, okay? And in fact, halal is actually not for Muslim only. So halal is actually for all, and halal is actually a new value for us to move forward in terms of our practice. So halal is definitely not only related to Islam, but it's actually for human being. Next. And I have to introduce you to two terms. One is halalan, the other one is toyiban, which mainly says that, you know, that the whole thing is talking about being wholesome, pure, healthy, and safe. So these are the two terms that involve halal per se. Next. Yeah. From another part, when you talk about the halal paradigm, okay, other than the halalan and toyiban aspect, if you look into the wider picture, it has to involve ethics. Okay, so this is a very paramount in terms of the understanding of the halal paradigm. So we are talking about three things: halalan, toyiban, and ethics. Next. Well, if you look into even in the Malaysian perspective, where we have our own code of conduct for pharmacists, which involves 7 principles, you can see that, you know, that most of it are actually related to patient, with expect to making sure that our practice is halal in nature. So I can identify principle number 1, make patient your first concern. Principle number 4, encourage patient and the public to participate decision about their care. And principle number 6, be ethical, honest, and trustworthy. Next. So if you talk about the halal-centric pharmacy practice, it just means that it involves a good pharmacy practice that we actually have a lot of experience, even with our counterpart in Taiwan and all over the world. And so halal is just an added value where we put the ethical aspect inside the practice. So this is something that I can share with all of you. Next. All right, this is a very important question. Where if a patient going to ask us, is my medicine halal? So what will be our answer? Do we know the status of the halalness of the medication? So this is something that we have to know. Or even maybe the doctor is going to ask pharmacists, okay, is the medicine what you call halal or not? Or even the non-Muslim pharmacists will ask the Muslim pharmacists whether that medicine is halal or not. So I think this is a very relevant thing that we need to know. And this is a very important question, because if we are not able to answer this question, then you know, it will affect our dignity and trustworthiness and so on and so forth. Next. Well, I like to share in terms of Muslim rights, Muslim patient rights. You know, they have the right to have halal medication. They have the right to have non-nudge medication, a right to be informed of their medication, and the right to choose their medication and to give consent for use of non-halal medication, which is part of this topic today. Next. Well, as you can see, if you look from the voice of the consumers, they also want halal certification. Other than food, they also expect medicine and also supplement. So I've been doing, you know, doing advocacy work in terms of the whether halal is important for patient And this is certainly a big thing in our place. So of course, this is from the voice of the consumer, and we have to entertain them. Next. Well, I want to share with you what are the issues in terms of the common non-halal experience, okay, that we have to consider in terms of the halal status. Of course, gelatin come into picture, stearic acid, glycerol, alcohol, and enzyme. Next. Next, please. All right. Actually, I want to share with you two what you call references. Number one is this Halal Index, Volume 1, which actually authorized by the late Professor Emeritus Dr. Zahri Ismail, which actually covers the pig-based pharmaceutical. In this book, you can see every part of the pig is actually being used in pharmaceutical, and we have to offer alternative for all this. So all this we have to know. Next. Also, you can refer to the Queensland government, where actually they have this reference regarding medicine and pharmaceutical for animal origin, which is actually published in November 2020. So these two references you can use to check in terms of the animal origin of medicine and pharmaceutical. Next. All right. As also mentioned earlier by the previous speaker, actually when you talk about the question of choice, so compliance is very important. So research has shown that 50% prescribed for long-term condition are not taken as prescribed. This is actually from the Royal Pharmaceutical Society of Great Britain way back in 1997, meaning they are not only talking about compliance, but they are also talking about concordance, which is very important, where the consumer have to participate in terms of the choice to use or to know about their medicine. Next. Well, the patient not taking medicine is still a major cause of unnecessary ill and health. But the most important thing is that they have to become active partners, okay, in prescribing decision, and their views and preferences have been recognized and taken into account. So this also are all very important aspect when you want the patient to participate in this decision. Next. Well, the Medicine Partners Program was established by the Department of Health UK, and they have actually promoted the concept of concordant or shared decision-making as an approach to help patients to get the most from their medicine. And the most important thing is the fact that it affects the religious and cultural aspect of, for this example, of porcine derived products. So this is basically in the UK. Even though, as you know, in UK the Muslim population is very much less. Yeah. Next. And so informed choice is also very important. I think I did mention about the right of the patient to know about their medicine, and when we inform them, so with this informed choice, then they will actually know what kind of medicine they are taking, and they have to participate in terms of making decision. So this is one example when you talk about involving patient in decision about porcine derived medications. Next. And so healthcare professionals need to define medical necessity and explore existence of alternatives. So this is something actually not only in Islam, I think even in Judaism, or even in for the Hindus, and even for vegans. So these are things that that we have to know and to serve our patient. Next. Well, I want to share with you about how I have done way back in practice in 1998, where this is actually a simple work process. If we in the formulary, where we can actually determine whether it is halal or not. Yeah. And in Malaysia, all products are have to be registered, okay, and they have to actually inform the regulatory agency if the product is of animal origin. So it is actually stated in the label as well as the product leaflet for information. So if we are aware that there is the product is actually from animal origin, we can actually verify with the manufacturer. So maybe they have halal certificate, or maybe they don't have halal certificate. All right. If they have halal certificate, we actually also can refer to JAKIM, okay, which is actually the Islamic affairs to actually check the halal status in Malaysia. And most important thing is that we make this information available across the institution, across the hospital 24/7. So that means doctors can refer to this, pharmacists can refer to this, nurses can refer to this, or anyone can refer to this. So we make it available to that, you know, they know the status of the halal status of the medicine. Next. So go back to the difference between halal pharmaceutical versus halal certified pharmaceutical. Okay, all halal pharmaceutical may not be necessarily be halal certified pharmaceutical, but all halal certified pharmaceutical are halal pharmaceutical. All right, next. And you can see even in Indonesia, you know, we are talking about, because the title of my talk is talking about confidence. So I think halal certification has been mentioned in this piece, talking about halal certification bring confidence. So in this one, we're talking about they're going to develop the Merah Putih vaccine, and to be granted by halal certification by the Indonesian Ulama Council. So they hope that, you know, that with this halal certification, the public confidence to use this vaccine will be higher. Next. In the Malaysian perspective, as mentioned by Christine just now, okay, this is the only standard in the world that we have in the world to produce halal pharmaceutical. Okay, and that standard is called MS, because the Malaysian standard, we call it MS 2424. Actually, it has existed in 2012, and it has actually been revised in 2019. Somehow or other in 2019, when I was involved, we actually put in the biopharmaceutical in. So that means as if we are ready for the pandemic, you know. So now with this standard, if they follow this standard, they can actually what you call produce halal certified halal vaccine. So we have that standard in Malaysia. Next. And how we did it, you know, you remember just now when I introduced the word halalan thayyiban. Okay, in Malaysia's perspective, there are two governmental regulatory bodies. Number one is a National Pharmaceutical Regulatory Agency, which actually registered all products. Yeah. So in our concept, we call it the halal built-in concept, so that when we produce the halal pharmaceutical, at the end of it, it is actually halal in nature. Yeah. So as you know, for any registration product, people talk about quality, safety, and efficacy, and they have to follow strict GMP, etc., etc. Yeah. And for the halalan part, this will be done by the religious body, as I mentioned earlier, JAKIM. Next. So in our practice, product must be first registered or notified with DCA, the Drug Control Authority, where we actually make sure that the quality, safety, and efficacy are evaluated. And if the industry want to go for halal certification, then they have to apply voluntary, because the halal certification in Malaysia is voluntary. We don't force people to go for halal certification. Okay, if they insist based on a business decision, then they can apply to JAKIM, where JAKIM will conduct the halal audits. After that process, JAKIM will issue halal certificate, and they also have the power to issue or revoke the certification. Next. So I want just to share some of the slides in terms of how this standard has been been used. So this is part of it, talking about the scope, normative references, term and definition, requirement, compliance, halal certificate, and also halal certification mark. Next. So, and you can see from the main features, it covers a lot in terms of quality management, management responsibility, halal assurance system, fundamental for halal pharmaceutical in GMP, halal quality control, personnel and responsibility, training, and even include personal hygiene. Next. And we also covers the premise, the equipment, production and control areas, ancillary areas, documentation, production, material, packaging material, contract manufacture and analysis. Next. And it also includes self-inspection, following legal requirements, compliance to all this, and at the end of the process, they will be given halal certificate and also the halal certification mark. Next. All right, so this is actually the what you call the photo of the Malaysian halal certificate. All right, so on the left is this is the only logo halal Malaysia being used globally, not only in Malaysia, but even used globally. And on the right side is the actual certificate. And of course, they have their own expiry, subject to the term of the product. Next. Well, I've been talking about halal pharmaceutical. It's really, we have a lot of, high potential in halal pharmaceutical, and we hope that we can actually raise this issue globally because this is now something that people are looking for at the global level. Next. Right, as I mentioned earlier, okay, the global communities are demanding only the purest and best ingredients. Okay, there is also an increasing demand for halal pharmaceutical. The Toyban part ensures safety, quality, efficacy, and hygiene. Also enable the industry as an opportunity to tap the huge potential halal market. And I mentioned earlier, halal pharmaceutical is for all. This is a new recognized value in the pharmaceutical industry. And of course, we have mentioned about the MS2424. And Malaysia is globally recognized as the best halal ecosystem because of the fact that, it's involved two government regulatory bodies. So people really trust this halal logo, not only in pharmaceutical, but also other, for example, food, beverages, what you call tourism, etc. So there's a lot that is covered under here. So halal is actually a viable investment. Next. And if you look into the, as reported by the Halal Watch World, when you talk about the global halal pharmaceutical industry, we are talking about the Muslim population. If you want to talk from the Muslim population, it's about 1/4 of the world population. Yeah. And the global trade, pharmaceutical trade, is actually USD 175 billion. Okay, and as I mentioned earlier, Malaysia is the trailblazer in certified halal pharmaceutical, and all has been covered. Yeah, but the most important thing is the fact that there's actually an increased demand for halal pharmaceutical globally, and and also because of the fact that because of the consumers' demand. But I think the most important thing is the fact that this halal pharmaceutical is not only for Muslim but actually for everyone globally. Yeah. Next. All right. I would say that the halal pharmaceutical market is actually a game changer. Okay, and the estimated value in USD, it will reach about 135 billion USD by the year 2026. Okay, and you can see that people are moving around across the world. One of it is actually to have a global standards. So I'm involved in this, where under the SMIIC, the Technical Committee for Halal Pharmaceutical Issues, the TC16, actually the chairperson is actually the late Professor Emeritus Professor Dr. Zari Ismail, yeah, and Malaysia play a big role in developing this standard. So one day in the near future, we will have a global standard for producing halal pharmaceutical. Yeah? And you can see that even in Saudi, okay, they see something that they can look into it. Previously, in my experience, we're talking about probably 10 to 15 years ago, they have a different viewpoint about halal pharmaceutical. But now, okay, even Saudi Arabia, of course, all the countries around that region are actually very interested, other than the region here, when you talk about this. Next. All right. If you talk about the even the current situation, I mentioned about the Merah Putih vaccine just now, yeah, in terms of halal certification. Of course, Malaysia also have decided, to go into this, and this is something that we can work to look forward for this in the very near future. Next. So I think in terms of this, I would end my talk to this, just to give you a brief account of what is actually going on, because halal pharmaceutical certification will definitely increase the confidence and the compliance of the patient towards taking medicine, as I mentioned in terms of the confidence. So I think for further information, you can email to me, and also you can access to my Facebook. So thank you very much, Christine.
Thank you very much, Mr. Amrahi. Thank you very much, Mr. Amrahi. You are truly a pioneer in your field, and I'm very impressed with how you compressed a very big body of work in a very small presentation, very short presentation. And I'm sure you're very eager to collaborate more with our participants.
Yeah.
So thank you for helping clarify for us what halal really means, and presenting an ethical and a very good rights-based approach to addressing the needs of Muslim patients. And you also showed us some references that we can look at in the future if we're interested in learning more about which products are halal, and of course of those with animal-based origin. And also, you also shared to us the general workflow for halal certification in Malaysia, which can serve as a good model for other countries. And this can really bring confidence among not only the patients, but also pharmacists who are serving the Muslim communities. And I think you also highlighted how it is important to increase the cultural competence not only of the practitioners, but also of the global pharmaceutical industry, as well as the government regulatory body. So thank you very much, Mr. Amrahi. And I'm sure we will learn more in the upcoming FAPA Congress this November. Thank you very much. So now let's proceed to the next part. So we have three panelists who will be sharing the experiences in selected Asian countries. So we have speakers coming from the Philippines, Pakistan, and the UAE. So I will introduce them first, all three of them, and then after my introduction, they will give their short commentary on the presentations and also relate it to their country's situation. So our first panelist to share experience in the Philippines is Miss Christine Catawera, and she's a registered pharmacist representing the Philippine Pharmacists Association and Young Pharmacists Group Philippines. She's currently taking her master's in public administration while working at the Philippines Department of Science and Technology as a Halal Program Management Officer. Our second panelist to share the experience in Pakistan is Dr. Rabail Kanwal. Dr. Kanwal completed her Doctor of Pharmacy degree, Master in Public Health, and recently her Master's in Business Administration with focus on corporate strategy. She's designated as the lady representative of the Pakistan Pharmacists Association and currently working as a philanthropist in the City Trust for Deserving Pediatric Patients of Oncology Hematology Department of the Children's Hospital in Lahore, Pakistan. And finally, but not the least, our third speaker comes from the United Arab Emirates, Dr. Nadia Al-Mazrouei, who completed her master's and PhD in the United Kingdom and is currently working as an assistant professor at the School of Pharmacy, University of Sharjah. She has shared her expertise by working in different settings, including universities, military hospital, and technical working groups of various organizations such as the WHO and the FIP. Dr. Al-Mazrouei is a former vice president of the Emirates Pharmacy Society and is currently serving as the president of the Eastern Mediterranean Regional Pharmaceutical Forum. So I think aside from the perspectives in UAE, she will be gladly sharing insights on experiences of other countries in the region as well. So please help me welcome all three of our speakers, and we will start first with Ms. Christine. I'll give the floor to you, Christine, now.
Thank you, Miss Christine, also. Bismillah. Assalamualaikum warahmatullahi wabarakatuh. A pleasant afternoon to the honorable guests, distinguished speakers, panelists, moderators, colleagues, and everyone participating in this event. First of all, I would like to thank FAPA and IAI for inviting me as one of the panelists in this activity, a very timely one. So in the Philippines, Muslims are a minority comprising of an estimate of 6 million Muslim Filipinos, which is about 6% of the total population according to the 2015 Census of Population. So as Muslims, we only consume what is halal, just like the presentation of Mr. Amrahi. So with consideration to this, some Muslim Filipinos have concerns on the medications. One example is the gelatin capsules. Just like gelatin, as we all know, have different sources, which may be from seaweed or fish or bovine or porcine. Another, they're concerned on the vaccines. Some are doubtful on the ingredients, thinking on the materials used if it is halal or haram. And that's the reason why halal certification in non-Muslim countries such as the Philippines is very important to bring confidence. In terms of the cultural competence of the Filipino pharmacists in relation to this, some, if not most, are not well aware on halal, specifically the halal pharmaceuticals. It's not included in the curriculum as in the previous years, you can only encounter the term halal in madrasa, mosques, and other Islamic institutions, which are few if I'm counting. And that's why this activity is very important as it serves as a first step on the awareness of Filipino pharmacists, taking into consideration the cultural practice in dealing with patients. And that's the beauty of it because through our colleagues in FAPA, in Indonesia, in Malaysia, and other countries, we can learn together. And just like in the presentation of Dr. Lucy, medication management in diabetes mellitus patients have already a lot to consider, like polypharmacy. And to add, the cultural aspect is crucial, which is not really considered here. And although it is written in the Holy Quran that ill Muslims, or sick Muslims, are not obligated to fast during the Ramadan, some opt to fast and they should consult with their doctor and the pharmacist, we pharmacists. So just as Doc Lucy said, no, we pharmacists have a big role to play in helping Muslims adjust medication safely during Ramadan and to identify anyone who cannot safely do so. So to end my discussion, I would like to recommend highlighting cultural competence in the curriculum and awareness of the needs of Muslim patients, having guidelines or standards or reference in the Philippines. To add, there are only 8 PNS or Philippine National Standards here in the Philippines, and none of that includes the halal pharmaceuticals. So, and also with FAPA, maybe we can have collaboration of countries like Philippines, which has a Muslim minority and do not have a lot of experience, with those from Indonesia and Malaysia and Middle East through a technical working group. So that's all. Again, thank you very much for inviting me to share during this event. Shukran.
Thank you very much, Christine. I'm also Christine. So can we have our next speaker, Dr. Rabail?
Thank you so much, FAPA, for inviting me as a panelist. As already much information discussed by our previous speakers, likewise, all over the world, Pakistan in Pakistan observe fast from sun up to sunset during Ramadan. Fasting during Ramadan is mandatory for all adult Muslims who are of sound mind and physically able to tolerate it. As it is already discussed that during fasting, everyone is refrained from consuming everything by mouth, including food, water, and medicines. Non-oral medicines like injectables, forceps, and eye or ear drops are generally permissible. The general rule of fasting is, if you can safely fast, then you do it. The safety assessment is usually falls on the shoulder of healthcare professionals who should approach the issue from shared decision from point to point view. The ban on oral medication during Ramadan can create dilemma in Asian countries like Pakistan to take part in it. Some common issues observed during Ramadan need to be addressed are poor compliance of treatment medication, poor dietary management that can lead to hypoglycemia. Fasting may affect the patient's health behavior, dehydration, weight loss, role of pharmacists, and some possible recommendations to improve situation of Muslim patients during Ramadan. Maybe pharmacists can play an integral role in dose adjustment and counseling of patients during Ramadan on ways to avoid potential hazards of fasting. Patients need to have pre-Ramadan health assessment. Educate and counsel patients about fasting and medication management. Pharmacists have to adjust the daily dose of patients into two divided doses so he can take it at Sahar and at Iftar. As already discussed, for the patient taking a medicine 3 times a day or multiple times a day, recommended strategies included choosing long-acting formulations such as sustained release, are changing dose regime to once or twice daily. Avoid dehydration by drinking ample amount of fluid between iftar and sahur. Maintain well-balanced, healthy diet that is rich in fiber and low in salts. People who would like to exercise are encouraged to do so after iftar time. Above all, pharmacists should be respectful of patients' personal wishes and religious belief when offer counseling. Most important, one point I want to focus here is post-Ramadan care. If alternative medication are were prescribed or doses were prescribed for fasting month, advise patient to switch back to regular regime after Ramadan after discussion with physician or pharmacist. Thank you so much.
Thank you, Dr. Rabail. Can we have our next speaker? Dr. Nadia, thank you.
Thank you very much for the invitation, really. It is really my pleasure to be here and to participate in this really interesting event. If we speak about the role of pharmacists, I think it is both, as of course, our speakers, honored speakers, they elaborate very efficiently, and they in everything regarding helping the setting rules and regulation for Muslim patients, how to deal with their medications, and to help the pharmacist how to apply the Islamic also regulations and ethics for the patients as part of their work, or as a part of their commitment for the patients from the pharmacist point of view, to give them the choice to choose the best medication for them upon their religion, upon their safety, upon the quality. And this is one of the things. Of course, everybody, Dr. Lusy and Dr. Amra, they and both, of course, our panelists, they cover very nicely all the subject. Only I want to add that the role of pharmacists, it is expanded worldwide. And I think also from the point of, as I am the expert in advisory panel, member of the expert panel in WHO for pharmaceutical preparation and for pharmacopoeia, we are taking care of these points, and we can collaborate more for the benefit of the Muslim country, as it is more, it is like 1.4% of the population, and we should, and there is a lot of alternatives suitable for the Muslim people to be choose their medications. And this is our role as pharmacists to elaborate and to also to contribute very efficiently in setting our rules and regulations for the benefit. Our aim is the quality of medications, the safety of the medication, and also ethics for the, and this is will lead to also applying the Islamic ethics for everything which is permit or halal in our religion. We should address it to the companies and the manufacturers to help us in setting these rules and to apply it for our patients for their sake. This is the first things. The second things that I am, as a president of Eastern Mediterranean also forum, part of the International Federation FIB, of pharmacists. Also, we are playing in setting many rules and regulations for the benefit of each region, because each region and each people, they have different challenges than the others. And we are also in Arabic countries, mainly in the Gulf region or in the Islamic world, this is part of it. We have to be playing a big role in advancing pharmacy profession worldwide. And our aim is to deliver the best and the quality of medication for the patients worldwide, and also to share our knowledge. As this, for example, I've been really very happy to attend this event. It is my first time also to be in this region. It is really very valuable for us to share our information and to be a part in many things to update the regulation, the policies for the sake of patients. As we said, anything in our Muslim countries, different than the other countries, which is Muslims and non-Muslims together. Most of our region, they are Muslim countries. So in UAE, for example, and Ministry of Health or other bodies, regulating bodies in Department of Health in different Emirates, we are applying these rules for the manufacturer to give us anything, or to declare anything from animal origin, and anything that it can be really a choice for us to be safe for our patients. In Saudi Arabia, also in the Gulf region, in Emirates, we don't face this problem because everything which is coming to our country, it is comply with the rules and regulations for Muslim countries. And really, the manufacturer, they are really playing a big role with us, and they are happy to give us also solution. This is one thing from the halal and the points. If we go to speak about the role of pharmacists in our region, also everyone to deliver and to also in case of medication management during Ramadan, I think you cover it very well also. The same things we are doing. We have to give them, counseling them on first to counsel on the disease, the management, especially the diabetes, for example. It is a big really issue because it got connecting with the food intake plus the disease progression. So if we control it by advising on the meals and also to change the timing because of the suhoor and iftar, and give them the advice how to take their medication. And we have a lot of variety of sustained release preparation available. We can give them, for example, like if you are going to give antibiotics, you can give, for example, Zithromax, which is once a day for 3 days. This is in case of Ramadan. This is the choice for pharmacists to provide the best solution for the patients to take it and to be fasting also, and to be also as a healthy. In case he is a mild to moderate risk, he can comply and he can fast and take his medication and shift all his medication to the non-fasting period, which is in the night. But if he is high risk, there is a clear permission from Islam to not to fast, and then even he can later on fasting it, or he can never get to fast, especially in case of elderly and polypharmacy, and a lot of medication is to be taken. Thank you very much really for the invitation, and I hope that we collaborate Eastern Pacific plus also Eastern Mediterranean region, and for the benefit of our patients worldwide. Thank you very much, and I'm calling also to call me to be part with everything you have it. My special thanks for Dr. Norel and for FAPA to invite me, IAI, to invite me to this really very interested, very efficient presentation and event, and especially for Christine also. Thank you very much for everyone.
Thank you very much, Dr. Nadia. So now we have the experience from Philippines shared by Christine. So Philippines especially is a Muslim minority population, and this is a common experience among different countries with the Muslim minority population, wherein there are many challenges because their needs are not really focused on. And then she also presented recommendations for the global community and FAPA to take, especially with future possible collaborations in sharing information and knowledge on these issues. From Pakistan, Dr. Rabail shared issues encountered by Muslim patients during Ramadan, which is quite similar even with the Muslim minority countries, and how pharmacists can support these patients not only in pharmacological approaches, but also in educating and non-pharmacologic approaches. She also highlighted the importance of guiding patients back to their normal regimen after Ramadan, which I think this is an additional information that we must pay attention to. And lastly, Dr. Nadia highlighted that right now the pharmacist has an expanded role in the global arena, and we need to address ethical issues in practice as well as the industry. And she also highlighted that there are different challenges in the Asian region, and pharmacists should step up to address inequities by sharing our expertise and improving our knowledge and skills for the sake of patients. She also shared that pharmaceutical manufacturers have certain rules right now in the Middle East, especially in declaring information, and this enables patients and health professionals to choose and have greater control over the products that they consume. Similarities in situations by Muslim patients, even with other countries, are also shared by Dr. Nadia. So with that, we thank our three panelists for giving your reactions to the presentations of our lecturers, Dr. Lusy and also Mr. Amrahi. Now, for our next part of the program, we have our questions that the participants submitted. So we have different sets of questions. Some were submitted from the registration and some are given live during the event. So may I ask my partner Anggun to help me ask the questions submitted by our participants for our speakers. Thank you.
Yes, Christine, we're here in the background trying to summarize all the questions. We have a few interesting question and not. So we just go ask directly to Mr. Amrahi because there's a question from is very interesting from Delhi Olidan. He's specifically asking whether the vaccine is halal or not because it's also the reason why in the region the BARMM of the Philippines has a low percentage of the vaccinated citizens. So they really have a concern about this. And even before the webinar start, there's also a lot of question about the vaccine. So Mr. Amrahi, I give it to you.
Okay, thank you for the question. I think this is a very relevant and I expect this question, Well, when you talk about vaccination and the halal status of the vaccine, I appreciate what Indonesians have done. When they actually faced the pandemic and to have the national immunization program, they actually went to China, okay? Both their scientists as well as their religious scholars to ensure that the vaccine is halal. Okay, so because in Indonesia, okay, they talk about two words in the vaccination program, aman and halal, safe and halal. That was actually the thing taken by Indonesia. For Malaysia, it's a bit different. Okay, we look at the overall program because it is necessity and it has to be done. So the fatwa is actually covers that it is halal to be given to the population. Of course, we are actually in the process of manufacturing what you call really a halal certified vaccine. I'll give you an example if you see whether you can understand from my perspective. Yeah? You look into the Pfizer vaccine. The Pfizer vaccine is actually from mRNA, all right? And of course, it doesn't have any animal origin, yeah? And then at the same time, you only talk about probably what, salt, yeah? Of course, probably PEG, proper ethylene glycol, and we didn't see any animal source. So if you ask me, my answer to you is a very straight, is halal in nature, right? And now in Malaysia itself, okay, I was actually being called, to discuss about how we want to go to the next step. So the next step will be we have to look into the whole process of all type of vaccine, whether is mRNA or vector borne, or from the variant itself, So all these are now taking into processes, and we hope that we have come up with a guideline, and we make sure that we will help not only in Malaysia but also to the world, because this is a very important thing. And I really agree that one of the things that is actually in some countries where where this is not being addressed, of course the what you call the taking up of the vaccine is very low. In Malaysia, thank God, In Malaysia, our national immunization program for COVID-19 is really up there. I think most of us have been at least one dose, and we have covered most of the population, even in the elderly as well as even in the children. So that is my answer to that question.
Okay. Thank you, Mr. Amrahi. And to continue a question about the halal, actually, this is a question come from me. And then this also when I'm working in the community as a community pharmacist, and then when I'm changing to the industry. And this is the most question. Like each country has has their own halal institution. Like Malaysia has JAKIM, and Indonesia has a MUI, and Taiwan as well has the THIDA. And let's take example. There's one medicines that widely available in the world, but only get halal certification from one country. Let's say only MUI from Indonesia. Can Muslim who lives in other countries obey and trust that this medicine is also halal for use everywhere? This is a question come mostly from my patient actually when I'm working in the pharmacy, and probably you can answer, Mr. Amrahi.
Okay, thank you again for the question. I think it's very important for us to understand the global picture as well as the regional picture. I think I did mention in my talk just now about SMIIC, the standard methodology for Islamic countries. That is actually going to produce the standard for the whole world. Yeah, and but because that one is actually part of the OIC countries, right? And we will actually deliberate at that level. So we hope that whether we have different sort of we call it the school, will be accepted globally, because we cannot, if in my opinion, if you talk about thing that's happening in all over the world, okay, especially in the Islamic world, so you will talk about the different channels or different types, so we have to come back to the main reference. So the main reference is actually Al-Quran and Al-Hadith. Okay, so we go back to that rather than we go into our own regional sort of thing. So we are not talking about Hanafi or Shafi'i or Maliki or whatever. So we haven't reached that point yet at the moment. All right, but if you ask me, all right, if for example it's been certified by Indonesia, I will be more than willing to take it. So we have to respect whatever thing, because they have their own reason for doing it. So I think this is the time for us to go global and to be accept global. But as I mentioned in the Malaysian experience, we felt that it's sort of the trustworthiness of the whole halal certification exercise. It has to be trusted. So that's why we use the two governmental regulatory bodies, because it's not part of the industries per se. So we are very strict on that, so that we will bring confidence, people to take it. And most important thing, I think, especially in our region, if Indonesia is going to talk about producing halal vaccine, and also Malaysia is going to talk about halal vaccine, so I would say that we should actually combine together. And because there are so many vaccines, it's not only COVID-19. We are talking about flu vaccine, influenza. We are talking about meningococcal vaccine, and so on and so forth. So there's a lot of things. So I think if we can do it, because I don't think one country can do everything. So I think most important of sharing and do this. So that will be important. So that's why when you talk about going into halal certification, it has to be there. The transparency has to be there. So which I have actually explained in my talk just now. So my answer to you, if that is given to me, I will take it. Thank you.
Okay, this also can be also answer for all the pharmacists that probably a patient come and then asking this type of question, so you can answer like that. Okay, thank you, Mr. Amrahi, and we'll go to Dr. Lusy. We have a few questions here, and this is quite interesting. The question is, If patients insist to follow their religious beliefs and practice in a certain way, especially during Ramadan, how can we best communicate and convince them about the importance of properly taking their medications? Please, Bu Lusy.
Sorry. Okay, sorry, unmute, Anggun. Wow, this is the difficult question, Anggun, because it's communicate is a very complex and we must to train and train and train. About the how to properly communicate to Muslim patient for the medication adherence, successful strategies to improve medication adherence is not easy. We already know about that, yeah. Before we communicate and educate patient, we must to understand each patient's medication taking behavior. So we can educating and empowering patient to understand the treatment regimen and its benefit. The practice we must to do is assess our body language when we talking with the patient. Always face them while speaking, show them to proper respect, and have a patient. And we can provide a simple written instruction so patient can understand well. Yeah, so patient understand and do our instruction or our education with good like that. Anggun.
Okay, thank you, Bu Lusy. Well, so far, I will back to you, Kristen. I'm try to looking out the question. I think most of the question from our participant already answered clearly by all our speakers. So I will go back.
Yeah, thank you. I have a question not only for the speakers, but maybe for all the panelists. My question is, how do you think can FAPA facilitate promoting cultural competence in pharmacists in different countries in Asia? Maybe not only for Muslim patients, but also for all cultural groups. Maybe any one of you would like to give some suggestions? Or also Dr. Robles is also here. Maybe she would like to give some insights on this matter.
Would you like me to start it, or would you like them to do it?
You can start, Dr. Robles.
Yes, okay. Thank you very much to our distinguished speakers and to the panelists. You have enriched our knowledge about two important aspects. One is the clinical, the medical, the provision of care, and the other one is on the halal products. These are very important components of cultural competence that our pharmacy should have. Now, I have realized that as we have gathered this afternoon, that FAPA has an important role to play. We can be a venue for not only for webinars like this, but really like what Christine Catera had mentioned, a technical working group that will really focus on a specific issue that confronts the Asian countries. And I think this is a good beginning of such. Another, for example, is the issue of disaster management. Remember that many Asian countries are prone to disasters, but if you take a look at the characteristics of countries, some of the countries in Asia are donors during disaster, but many countries are recipients. But sometimes the problem is in coordinating, let's say, donations coming from donors to recipients. And because we are concerned as an organization, we are concerned with access. we wanted people to, for example, affected people to be getting the right medicines, and that there is equity in the distribution of these medicines. And so I was telling Christine Benosa that that could be one role that FAPA could take. We can become a venue so that we could encourage not only for example, the creation or formulation of policies, but we could facilitate coordination and collaboration among countries regarding specific issues. I think with that, it will be a good contribution to how we can really strengthen. That's the topic in Malaysia, isn't it? Strengthen the pharmaceutical systems, the health systems, and of course, we have a niche there, and that's the pharmaceutical system. So I thank you very much for giving very good ideas that wherein we could really improve the provision of healthcare to Asians. And I welcome Dr. Nadia, who would like to be active in the activities here. Of course, we have members from Middle East, and so we would be expecting more collaboration in the future. Thank you very much.
Thank you, Dr. Robles. I think our participants also had this question because each country has their own halal institutions, like in Malaysia and Indonesia and even in Taiwan. And but sometimes other countries don't have their own halal institutions that will certify. So sometimes pharmacists are asking, there's only one product and it's certified in another country, but they're wondering if that certification from another country or any country, is that acceptable for other Muslims in other countries? I'm not sure whether there's like a harmonization of halal standards among different countries. Can any one of the speakers say something about this? Thank you.
Yeah, I think this is a very relevant question, which actually we have been looking at it for many years already. Yeah. So as mentioned earlier, we will have a move, in this coming future, where people talking about harmonization and so on and so forth. As far as JAKIM is concerned, they have actually certified a lot of certification body across the world. So if they are part of, which actually endorsed by JAKIM, it can be used in Malaysia, for example. So I think even between the MUI and also with JAKIM. So all this have to be, I think, like what Dr. Nadia says earlier, you have to come forward and share all this rather than taking a different approach. So I think we have to have a meeting point, probably, as I mentioned earlier, as the SMIIC, and also with the what you call for the Islamic countries, right? But rest assured that this is one of the most important thing that we have to overcome. All right. So far, we have no problem in this sort of aspect when we have a certification body, right? So I think it has to be addressed at the global level in terms of why. So maybe for FAPA, we can have our stand on this. Even if FIP, I'm also quite active in FIP. So I think we can start all this like what Ms. Christine mentioned about, probably have our own technical working group and see how we can go from here.
Thank you very much, Mr. Amrahi. Anyone else who want to comment on this?
Yes. Thank you. Thank you, Mr. Amrahi. Yes, this is what I want to say, that Muslim countries, it's covering more of the continent, like in Asian, there is in Eastern Mediterranean, and also in African region. So we can help all to unite and to do workshops for the education and benefit of pharmacists, to deliver and to know how can they perform halal and helping especially Muslim countries to set their rules and regulations, and sharing their experience and helping each other. We can work together from different forums also through FAPA and this is one of the organization because it is international organization also, and also FIB, they are welcoming this participation, and everyone, we can address our challenges and we can help each other in these things. The second things, I can also address it to WHO, as I told you, I'm a member in expert advisory panel in the pharmacotherapy. If you have anything, we can address it also. They are welcoming all this. And I have, after 2 days, a meeting. We will start a meeting for 5 days with WHO, with the expert. And this is one of the things that good that I got this meeting with you now, and I got and I'm very happy for the advancement that you are reaching, especially in Malaysia and other countries, also Muslim countries, Philippines, everywhere. Taiwan, Indonesia especially, but Indonesia even they sign with the FIB also, and they've been really very active. We want to be more active in the FIB regarding of knowing our challenges and sharing experience and the support of international bodies like WHO and the FIB. Thank you very much for invitation again, and I would like really to participate in any field you want me to be in. I'm supporting everything 100%. All what you say about Muslims, about rules, about regulations, and we can share with us everything. Pakistan is one of the countries with us in Eastern Mediterranean region. So thank you very much for participation also together. Thank you.
Thank you, Thank you very much, Dr. Nadia. I think this is what Dr. Robles was really saying about not just thinking about our own country's improvement and our own practice, but rather thinking what we have, we can contribute to other countries so that together we can improve all the standards and share information to help patients globally, and also especially in the Asian region where there are a lot of challenges encountered by the diverse population and also by minorities. So I think at this point, yes, there's also a participant who said we need to be globally competitive. And I think not just competitive, but globally cooperative.
Yes,
so
I think cooperation should be globally for the benefit of a human. So we can all together make a change when we want to address our point of view, and we agree on these points. Thank you very much.
This is giving me chills. I'm very happy to hear this from all of you. So I think at this point, as Mr. Amrahi was saying, there are still many things to be done in this field, and this is a huge concern for very big population in Asia. And we hope this event will just be the beginning for greater collaboration in the future and activities to improve not only the products, but also services, so that patients will be more confident in their medications and also in their pharmacists, so that we will be more responsive to their needs. So I think there's no better time to start addressing these kinds of inequities than now. And we have seen this with the COVID pandemic, how important really it is to work together in solving inequities and contributing what we can for the benefit of all patients. So at this point, I think we don't have any more questions. And before we close, I really want to thank Ikatan Apotheker Indonesia, led by Pak Nurul, and this event's organizing committee from the side of IAI and also FAPA, and also FTPA, who showed their support for this event. Especially at this time during Ramadan, and we are very grateful, and even with a short notice. So we also thank all our speakers, panelists, and participants for spending a portion of your weekend for this highly productive, and actually for me, it's very inspiring learning session. So thank you very much, Anggun. I'll hand over to you. Thank you.
Okay, thank you, Christine, and all the speakers and the panelists. For those who want to get certificate of attendee from FAPA, please fill out the post-event survey. Even for all attendee from YouTube, hello YouTube, you can also claim your certificate of attendee from FAPA. Just please fill out the post-event survey. Do we have a time, Christine, like until when we're going to close the post-event survey?
Yes, the post-event survey will be open up to April 30th. So after April 30, we will be closing that. And for those who will be submitting their post-event surveys, they can receive a certificate within 5 working days. So just please wait for it in your emails. Thank you very much.
Yeah. So that's the certificate of attendee from FAPA. So for Indonesian participant, you already got your SKP melalui siap. Itu sudah otomatis ya, Bapak Ibu. Okay. And once again, we would like to express our gratitude to all the speakers and panelists, not forgetting all pharmacist participants. We would like to convey our utmost gratitude for your participation and the support. Thank you and have a pleasant day. See you in FAPA Congress this November in Kuala Lumpur or in another IAI webinar. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Anggun.
Thank you, everyone. Thank you, Christine, Anggun.
Thank you,
everyone.
Thank you, Dr. Nadia. Nice to meet you.
Really, it is my pleasure. Thank you, Doctor. Thank you very much.
Thank you, Dr.
Dr.
Nadia.
Roberts, thank you.